the patient's room. I'm going to check her MAR and see what kind of order I have. And it looks like I have an order for a wound culture collection. So I'm going to be irrigating her wound, collecting that culture, and giving her a new dressing too. So I've gathered all my supplies here. I've got my wounds care kit, I've got some gloves, I've got my culture collection kit, and everything's here. Hey, Miss Smith, how are you doing?
Doing fine, thank you.
Great, I'm gonna go ahead and close the door for privacy. Miss Smith, I'm Savannah, and I'm going to be taking care of your abdominal wound today. All right, I'm gonna go ahead and kind of start to get my supplies ready, clean off my surface. Miss Smith, what we're gonna be doing today is, first of all, I'm going to clean your wound and change the dressing so that we make sure it's healing well and effectively. And then I'm going to collect a sample of your wound, so that we can see what's kind of growing in your wound and we can treat it in the best way possible. Okay, and afterwards, of course, I'll give you a new fresh dressing so we make sure your wound gets better and heals well. Miss Smith, can you go ahead and tell me your name, full name, and date of birth?
Melissa Smith, May 5th, 1994.
Okay, great. I'm going to go ahead and check your armband too. All right, looks good. All right, let me get some of my supplies set up. Now, about 30 minutes ago, I did come in and assess Miss Smith and ask her if she needed pain medication, and she did not. But if she had, or there was an order for pain medication, I would have done that then to make sure there was time for the medication to take effect. Okay. Let me go ahead and get my biohazard bag ready. I'm going to be putting all of my trash in there today. And I'm going to go ahead, Ms. Smith, and get you in position. So I'm just going to uncover the area that I need to. I'm going to raise the bed to a comfortable working height for me. And I'm just going to go ahead and get her in a good position. All right, you feeling okay, Ms. Smith?
Yes, thank you.
Okay, great. Next, I'm going to place this pad under her, this waterproof pad, just in case we have any leaking as we're working. All right, I'm going to go ahead and do my hand hygiene and put my gloves on. I'm ready to remove that old dressing. So when I'm removing the dressing, I want to work gently. I want to keep the skin taut and pull the tape in the direction of the hair using the push-pull method. Okay, there's no sticking, so that's good. And when I look at the old dressing, I want to note as far as the drainage, the color of it, the amount of it, any odor, and document that. Okay, so I'm going to go ahead and dispose of my old dressing and my gloves in my biohazard bag down here. All right, and I'm going to do my hand hygiene again. All right, Ms. Smith, next I'm going to assess the wound and kind of its progress. I would want to know its color, appearance, any slough or eschar, any changes, irritation to the skin surrounding the wound, and I would want to note the size, the length, and the width, and document that as well. Okay, now it's time to clean the wound. So I'm going to go ahead and get everything set up here in my space. I'm going to open up my wound kit. And as I open it, I'm going to open it towards me first. No, away from me first. The last flap towards me, and then I'm going to, only touching the underside, turn it. Now this table is a little bit small. It's the only thing I had to work with. So ideally I would not have it hanging off like this. I just don't have a bigger table. All right, next I'm going to open up my wound care tray. I'm going to get my supplies out here. As I open up this, I'm going to drop it onto the tray. Discard of it. And then I'm going to get my sterile saline solution out. Open that up and pour it on my gauze that I'm going to be using. Put that over here. Alright, I'm going to go ahead and put some more gloves on. Alright, so as I work to clean this wound, I'm going to grab a piece of gauze at a time. And when I clean, I want to move from top to bottom and inside out. Disposing of this gauze as I go. Only using one piece of gauze for each stroke that I make. How you doing, Miss Smith? Does that feel okay?
Doing fine, thank you.
All right, great. Just let me know if it hurts, if you feel any pain. Okay, once I have cleaned the wound, I'm going to go ahead and dry the outside where I got any moisture. Just kind of patting around the edges. Making sure it's nice and dry. All right, next, I'm going to get ready to do my culture collection. I'm going to go ahead and get this out. It's wrapped up, so I'm going to put it on my surface here. And I'm going to draw on some new gloves. Alright, and when I do this culture collection, I want to make sure, as I'm using the swab, that I'm going on the inside of the wound, not getting the outside edges, but the inside. And so I'm going to kind of press down gently and roll that swab on the inside of the wound. Okay. And now I'm going to make sure I don't touch this swab to anything except for the inside of this tube. So I'm going to put it in the tube. All right, and that is done. Okay, next I've got to put a new dressing on the wound. So I'm going to go ahead and get some fresh gloves. All right, and if I had any like barrier cream or an order for any type of topical medication, I would put that on at this time before I dress the wound. but I don't, so I'm going to go ahead and put some clean gauze on the wound. Okay. And then on top of that, I'm going to do a larger pad. I'm going to be taping that. And I want to tape it on all 4 sides. Kind of tricky. All right. How's that feel, Miss Smith?
Feels great. Thank you so much.
All right, great. So now I'm going to document on my dressing my initials and the date and the time of this dressing. Okay. And also while I'm documenting, I'm going to go ahead and document my culture collection as well. I've got to put the patient's name, date, and so on. Okay, I'm going to go ahead and put this in my bag to take to the lab. Now I do want to dispose of all of my supplies into the biohazard bag. And I'm also going to document that I did this dressing change. Again, like I mentioned, my assessment of the wound and what it looked like. And then I'm going to get my patient comfortable again. Raise the bed back, lower the bed back down. Raise the sidebars. All right, Miss Smith, well, I'm all done. I'm gonna get everything cleaned up here and take it out with me. Is there anything else you need?
No, thank you so much. You've been great.
All right, I'll see you in a little while. Thanks. And go ahead and dispose of everything again in my biohazard bag. And take it out with me. And my